All right, now I'm going back to share. I apologize. So as I mentioned before, we are not going to be able to address everyone's specific situation. So we want to make sure that you understand that you need to seek professional guidance when it comes to um, your circumstances, your situation, whether it's financial or about your service history, your insurance. Make sure that you seek a professional that can help you to cover some of the things that you might, think of or worry about during your time as preparing for retirement. Also, as I mentioned, this webinar is being recorded, so please wait until the end to ask your questions. You can drop them into the chat and we will address them at the end, but also we want to respect your privacy. So that's why we are not going to be addressing specific questions during the webinar. So any questions that you have, please make sure that you drop them into the chat and we will address them at that time. In addition, I know that you all have specific questions that you may not be able to cover during the time that we are online today. So make sure you are scanning this QR code, and as the webinar goes on, I will be dropping links into the chat so you can schedule a 15-minute consultation with myself and Darlene so you can get those really specific questions that you need answered as it comes to your benefits and retirement. So why does this matter? Why is it important for us to go over and making sure that you understand that you need to protect your federal benefits? Well, of course, they are one of the most valuable assets that you have because you spent your time as a federal employee gaining and getting these benefits, but not just for yourself, but for your family as well. So we want to make sure that you understand about the important decisions that you have to be able to know what to protect. You need to know how it's going to affect your health insurance, your life insurance, your retirement, your FERS or CSRS, whatever retirement system that you might be under, your future health care choices, your finances, security for your family, as well as your retirement lifestyle. So we're going to be covering these items during this webinar and making sure that you understand how to make sure that they're protected. So some of the things that I'm going to go through today is talking about your health insurance and the FEHB Protection Act of 2025. Put in the chat a 1 if you even know what that is. If you know what the FEHB Protection Act of 2025 is, put in the chat because you're probably way ahead than most people are. And then we're going to talk about the life insurance, the FEGLI, a little bit of the TSP, Social Security, Medicare. That's the Darlene's area right there. I'm going to leave all that to her. And then we're going to talk about practical next steps that will help you to increase your awareness on understanding your benefits. And I know this sounds like a lot. We don't expect you to try to gain knowledge of everything today. That's why you need to schedule those 15-minute consultations with myself and Darlene so you can be able to understand more as it pertains to your particular situation. So let's talk about the health insurance. We know that health insurance is more than just health insurance, right? It's about protecting you and your family during not just now, if you're working, but into retirement as well. And then we also want you to make sure that you're reviewing your health insurance. If you attended the webinar I did last month, then we talked about the mid-year checkpoint, making sure that you are looking at the services that your health insurance provides and seeing those little things that might change. I shared how I noticed this year I'm starting to pay a little more out of pocket for services that were free in the past. Something I did not do was check the health insurance this year in 2025 about what services are changing for 2026. But believe you me, I will be checking for the things that might be changing in 2027 before I stay with my current health insurance, because those little things can add up. So you want to make sure you're checking your current plan, making sure that it's sufficient for you and your family needs. What changes might occur within your family's health needs that you might need to be aware of, and see if your current health insurance is going to be able to provide that. Also, you want to look at the cost, of course, but not just the cost of the premium, but you want to look at all the other little costs that come along with that. Look at your deductibles. Look at the things that you're going to pay, those co-payments that you are going to pay when you go to the doctor. How is that going to change in the upcoming years? And how will that affect you, not just now, but into your retirement? And then during open season, you can make all the changes that are going to come for the new year. But again, you want to make sure about those out-of-pocket costs and how that's going to affect you. And I mentioned about the FEHB Protection Act of 2025. And I didn't see any ones in the chat. Darlene, did you see any ones in the chat? Did anybody say they know what that is? Nope. No one knew what that was, right? Okay, I'm going to tell you what that is. Let's say you got married and you got married in 2026. You have federal health insurance. So normally with a life event, then you would be able to submit your marriage certificate, and you would go on and have your spouse include on your health insurance. All right, let's take this same scenario, but instead of you getting married, you're already married, and your spouse may have already had health insurance through their employer. Well, now you want to add your spouse to your health insurance during open season. In the past, all you had to do was fill out the form, either online or the paper, putting down your spouse's name and submitting that to your HR office or to OPM if you're retired. Not anymore. Not anymore. If you are going to change your health insurance and your family member was not already on your previous health insurance, if you will make a change during open season, then you have to submit documentation showing that that is actually a family member. You can't just write it down saying, this is my child, this is my spouse. So you have to show documentation during open season. So that means that you have to find that marriage certificate. Well, if you've been married 10, 20 years and your spouse didn't have coverage because they're losing coverage, or they're retiring, and so they're going to lose their coverage, and you're deciding to put your spouse on your health insurance, you have to show your marriage certificate. You have to show documentation that that person is actually a family member as listed under the FEHB rules that OPM has. So make sure that you have copies of those documents in case you're going to make any changes in the future, because you'll have to submit that. And that's something that they started a few years ago for new employees. When a new employee came on board, they had to provide documentation, copies of their marriage certificate, copies of their children's birth certificates. But now they're doing it also for current employees and retirees. If you're going to change to a new health insurance and that person wasn't on the health insurance before, during open season change, you will have to provide the proof to show that that is actually a family member. All right, life insurance. Things that you want to make sure that you have up to date, and you want to make sure that it's all ready, are beneficiary forms. You have to make sure that the information is up to date. So if you wish to have your life insurance to be dispersed based on a will or trust, that has to be on your beneficiary form. You cannot just say that to the beneficiary, oh, it's going to go according to my will or trust. It's going to go according to what's on that beneficiary form. And if you don't have a beneficiary form on file, it's going to go according to order of precedent. So you want to make sure you have that beneficiary form on file, and it's listing the information as you wish it to be listed, such as who's going to get what and the percentage. Make sure that all of that information is updated. So let's say, for example, you have a child, that child got married. You want to make sure that it has your daughter's correct name. You want to make sure it has all the correct addresses and the percentages. And you know you can make changes to your beneficiary form as many times as you wish, whenever you wish. So it's not during open season. It's not, just when you have a life event. It is whenever you decide, oh, I can tired of that person. They're not acting right. Let me take them off my beneficiary form, and I'm going to add this other person, give them some more. Just, you don't have to do it that way. But there are things that you should be doing and being aware of, and making sure that your beneficiary forms are up to date and you have everything there correct. Your coverage. How much coverage is what you need? Do you have the amount of life insurance coverage through your FEGLI that's sufficient for you and whatever your family might need if you are no longer here or when you are no longer here? So you want to make sure that you are looking at those things, and you can decrease the amount of coverage at any time, but you can only increase the coverage if you have a qualifying life event, such as you getting married or divorced, adding a child, or the death of a dependent. So you want to make sure that you are increasing or decreasing it based on what you feel that you want to lead to your family and what their needs are. Another thing I want to talk about are your retirement options. So I want you to put in the chat, 1 is the lowest and 10 is the highest. And I want you to answer this question. On a scale of 1 to 10, how much do you understand about your options for continuing your FEGLI coverage into retirement? Even for those of you who are already retired, because I know it's a couple of retirees on the line, did you understand how much you could continue into retirement when you were retiring? So let me re-ask this question. How much do you understand about your options for continuing your life insurance into retirement? Put a 1 if you really don't understand, a low, or a 10 if you understand everything. So I see Rhonda's put a 1. Who else? Okay, we got Lisa 4. It's confusing. Let's just say it is confusing about the options that you have when you leave your federal government. If you have basic, okay, what can I take a basic? How long will it last me? What are these reductions? You said a 75% reduction, but what does that really mean? Is it going to be reduced? Like, am I getting 75% of what I had, or am I getting 25%? What is, why do I need to have basic? Why I got to pay for it? All kinds of things could be going through your head. Why can't I keep all the coverage that I had? How much is that going to cost me? All those things be going through your mind, and that paperwork is very confusing. So you make sure that you're talking to your HR person so they can break it down piece by piece. How much is it for myself for basic? How much is it for a standard? How much is it for additional? How much is it for family coverage? So making sure that you understand all of those components. Don't always listen to everything that you hear once you're out in the world, because they'll say, oh, the federal life insurance is very expensive if you continue it. It can be, depending on what options you choose. So you want to make sure that you are reviewing the information, making sure that the elections that you make with your life insurance are the ones that you know that is going to be good for your family needs once you are no longer here. And then your family needs. What are those actual needs? How old do you think your children will be or your spouse will be at the time of your retirement? And then, how long, based on, family history, how long do you think you'll live or your spouse will live in order to have that money? And then if you do have a spouse, then are you doing a survivor's benefit? If you don't have a spouse, then what other people are involved in this and what needs do they have in order to make sure that your funeral services are covered from this money, if that's going to be used, as well as any money you want to leave over to them. So here's a question I want you to ponder. As I always ask, a question to ponder. How well does your current life insurance coverage affect the needs of the people who depend on you today? Not the needs you had when you first enrolled. Because many of us had 20, 30, almost 40 years of federal service, and those needs of our family have changed. So I'm going to repeat this question. How well does your current life insurance coverage reflect the needs of the people who depend on you today, not the needs you had when you first enrolled? And this doesn't have to be just FEGLI coverage. It could be coverage, life insurance coverage that you had outside of the federal government as well. So let's talk about the Thrift Savings Plan. This is one part of your retirement income. And a lot of times, people are like, well, I'm not going to touch it because I'm going to be penalized, or I'm going to roll it over into another account. There's a lot of different things that you can do with it. And so there's a lot of decisions that you need to make. So we want to think about your long-term goals. Think about what type of retirement lifestyle that you want to have and how your TSP will play a part in that. Also, we want to talk about or think about investment. Speak to a certified financial planner to determine which funds would be best for you based on your long-term goals. And then the distributions, based on the first two things about your lifestyle, your long-term goals, and your investment, how much do you want to contribute if you're still in the federal government? How much do you want to contribute? Too little? Right now, do you think you're contributing too little? Do you think you're contributing just enough? Or do you think you're contributing too much? Again, you want to talk to a financial planner to help you put all those things together. And then going back to your beneficiaries, like I said before, making sure that your beneficiary forms are updated and have the correct information. They don't have to be the same people on your TSP as you have on your FEGLI, but you want to make sure that whoever you have there has the most recent and updated information. So a question to ponder for this is, if your TSP is intended to support your future lifestyle, what steps are you taking today to ensure it aligns with your retirement that you envision? I'm going to repeat this question. If your TSP is intended to support your future lifestyle, your lifestyle into retirement, what types or what steps are you taking today to ensure it aligns with your retirement that you envision? So now I'm about to turn it over to Ms. Darlene Jenkins, and she is going to talk about Medicare and Social Security. And so I've provided, a high-level overview of several of the federal benefits and practical actions and questions for you to ponder today. And one area that I'm always asked about is Medicare, Social Security, how they work and everything. And the first thing I say is, I'm not an expert in that, but I know somebody who is, and that is Ms. Darlene Jenkins. And so she's going to be talking about Social Security eligibility with you, when to apply, Medicare Parts A, B, C, D, Z, F, G, with all those multiple parts of Medicare, Medicare enrollment, and how, most importantly, how it works with FEHB. So before I turn it over to Darlene, I want you to think about these questions that she is going to be explaining things to you. What questions have you been putting off asking about Social Security because you weren't sure where to begin? That's the first thing. How might understanding your Medicare options before you're eligible help you to make more confident decisions when it comes time for you to apply? And what would greater clarity about how Medicare and FEHB work together allow you to do differently as you prepare for retirement? So I'm going to stop sharing my screen and turn this over to Darlene Jenkins.
All right. Good afternoon, everyone. I appreciate everyone jumping on. Thank you so much, Sharon, for allowing me to come on and share with the group. I'm excited to to do so. So let's just go ahead and jump into it. I'm just going to highlight these federal benefits, Medicare, Social Security, and your FEHB. All of these decisions are going to shape your retirement. None of these decisions stand alone in a silo as you are thinking about each of these. So when it comes to Medicare, Social Security, the goal is not just simply to enroll. The goal that we're looking for is for you to coordinate your benefits so that your retirement income and your healthcare plan will work together. Just give me 1 second here. Okay, so tell you a little bit. I am Darlene Jenkins. I work with Affordable Benefit Solutions. We are a women-owned business. I have over 37 years of experience in the financial services industry. We are federal benefits consultants. That's why I'm partnered with Sharon from Royalty Business Consultants, and we specialize in educating the employees on their government employee benefits and then creating a roadmap to retirement for them that we call your financial destination. And we consider ourselves community resource partners, and we are a full service wealth management firm helping you successfully prepare for retirement. So just a little bit about me, letting you know more about me. I am a native Washingtonian right here from the DC area. I also am a former government employee. I actually left the government at the end of 1990 and entered into the financial services arena where I have been ever since. I do these sort of benefit briefings for different agencies. ATF, we have a couple coming up with them. We also do them for Aetna. Yes, Aetna, the FEHB plan. We do the financial briefings for them. We do it for some of the affinity groups, Blacks in Government, FEW, FAPAC for the unions. So we are very immersed. I have, and I'm a Medicare planner. That's why I'm going over that, as well as a certified estate planner. So at ABS Retirement Solutions, we focus on, this is going to be very high level because we focus on holistic and comprehensive approach to your retirement strategies, putting all of these things together. So we're going to go over with you the 5 areas for comprehensive retirement planning: your income, how is that going to be structured, your insurances, as Sharon just went over, your FEGLI, your taxes, your health care, and then putting a bow on it for your legacy. So the 5 decisions that we're going to go over today, I'm going to connect them. So your Social Security, how do I qualify? When do I qualify? And what benefits are going to be available? Rosa, when should I take it? When do I apply for Social Security? Because the decision you make surrounding that is going to have a lifetime effect on your income. And then the alphabet soup for Medicare. I'm going to go over what each part does, your enrollment, when you should enroll, because if you don't get that right, that could cost you as well. And then your FEHB. And I want you to keep in mind that every choice you make is either going to help protect your retirement income, it's either going to help you have more flexibility, or it's going to create an additional cost for you. So, Social Security, let's just jump right into that. What has to happen? When are you eligible? Do I qualify? If you work for at least 10 years full time, you have in your quarters. You have to have 40 quarters in order to qualify for Social Security. So each quarter for 2026 is worth $1,890. So if you've earned $8,000 for the year, you have your 4 quarters that are required for the year. Now, what amount am I going to get? Your Social Security is based on your highest 35 years of earnings. So when you if you weren't working, you started working late, or you have some low numbers or zeros in there, that's going to affect. That's why everyone's Social Security amount is different, because it's based on your 35 years of earnings. And then other things you should think about, if you're married, am I going to leave a survivor benefit? Am I divorced? Are you the divorcee? Can you claim on your spouse's record? If you're going to keep working, how is that going to affect your spouse? So all of those things are going to come into play. Now, Social Security, for those of you, how many of you are still working? What system are you under? Are you under the FERS system? Are you one of the old civil service people still hanging on? Which system are you under? If you're under FERS, put a 2 in the chat if you're under FERS, because with the FERS system, you have a 3-tier system, as Sharon mentioned. You have your pension and you have Social Security. And the other option is TSP. So when you are thinking about your second tier, which is Social Security, the timing of when you take your Social Security, that is going to determine how much stress or how dependent you're going to need, may have to be using your TSP and other retirement income. So the timing, how much, do you need? When should I take it? Now, when should you claim Social Security? When you claim it, people say, well, what's the best time? When should I take it? Just saw right now. Well, people were saying you should take it at 62 because the break even point, everybody's situation is different. And that's why at ABS, what we do when we sit down with our clients, because let me ask you, how many of you right now have a written retirement income plan? Written retirement income plan that tells you when I'm going to get this, how much it's going to happen, how much I'm going to get, and if it allows for the what ifs that come up in life, like getting sick in retirement, your spouse getting sick. So now, when do I take Social Security? Now, the earliest anybody, whether you're in the government or private industry, can take Social Security is age 62. So if you take it at age 62, then you're going to have a reduced benefit. But it helps you if you need the money right now. So if you, depending on your age, you're going to have anywhere from a 25 to 30% decrease in your Social Security benefit. And that decrease is permanent. I can't tell you the number of people I've talked to that were under the impression that if I take it at 62, yes, I'm going to have a lower amount, but once I reach my full Social Security retirement age, it's going to go up to what it is, what it's listed on your statement or what it's supposed to be. No, that is not the case at all. Once you opt for that reduced benefit, it's permanent. You're going to have that permanent 30% reduction. Now, if you choose to wait, you can delay it and say, okay, well, I'm going to wait. My full Social Security retirement age is 67. So anybody born in the 60 from 1960 on, our full retirement age for Social Security is age 67. Now, I can remember when it was age 65 for everybody, but they changed that and started having a gradual increase based on your date of birth. So if you were born after 1960, your Social Security full retirement age is 67. Then, of course, if you choose to wait, let's say you're working, you've reached your full Social Security age and you're still working. I don't want to take it because I'm still getting a check. For every year that you don't claim your Social Security benefit, then you receive an 8% increase in that benefit amount. Those increases, however, stop at age 70. So the real question becomes, when should I claim it? There is no best time. It's based on your individual circumstances. Do you need the money now? How much income do you need? Because as I said, if you claim at 62, yes, it's going to solve the income need that you have right now, but you're at a reduced amount. And how are you, if you say, well, no, I'm going to wait till I'm age 67 and get the full benefit? How are you going to bridge that gap from 62 to 67? because you're retired. So let's get into that. Because if you're under the FERS system, because it is 3-tier and the earliest anybody can take Social Security is at age 62, you all can retire anywhere from age 55 to 57. You can retire before age 62, right? So here you are, you've left the government and you can't collect the second tier of your system until you are 62. So what the government did was they came up with the first supplement to bridge that age gap between 55, 57 to age 62 when you can now claim Social Security. But there's some important things to know. So you retire and you're under age 55. I mean, under age 62, right? You're going to get a FERS supplement. This money is not coming from Social Security. It's coming from OPM. And it's going to be included on your check with your pension. Now, there is a caveat. Once you turn age 62, the supplement that the OPM was giving you, that is going to stop. Now, you've been getting this money since you left the government. Now it's going to stop. You have a decision to make. You may have said, well, I'm going to wait. I'm not collecting my Social Security until my full Social Security age. But that extra money that you were getting from that supplement has now stopped. Where are you going to get the money from? That's when that extra stress on your TSP, if you have not planned properly, is going to come into play, because how are you going to bridge that gap, right? How am I going to get there? And how do they calculate what your FERS supplement is going to be? Let's take a look at that. The formula that they use is that they take the number of years that you have worked and they are going to divide that number by 40. So if you work for 30 years, they divide that by 40, you're going to get 75% of the amount that's on your Social Security statement for age 62. Now, in this example that I have, I said a person who retires at age, who their Social Security amount at age 62 is $1,600. So when they retire, they're going to get 75% of that $1,600, which is $1,200. But after they turn 62, they get zero. But now you can turn on your Social Security benefit of $1,600, but your full benefit may have been $2,400. So you're going to be stuck at that $1,600 plus the cost of living increases. So having a written retirement income plan is going to be crucial, because that determines how you're going to move, how you're going to get all of these things, figured out. So let's jump into the Medicare. And if you have any questions, put it in the chat, and everyone that's on here, as Sharon mentioned, you'll have an opportunity to have a complimentary 15-minute strategy session with myself, with Sharon, to answer your specific needs. Now, Medicare, let's just get into that. The ABCs, DEFGs of Medicare. So Part A, that is your hospital benefit. That covers your inpatient hospital. Part B, that is your medical. That's your doctors. That's your durable medical equipment. Part C, that is your Medicare Advantage plans. Now, also, it's not considered a Part C plan, but along with the Medicare Advantage plans, there are also Medicare supplement plans, or Med Sups. That's what they're referred to. And then Part D, that is your prescription drug plan. Now, if you're on here and you're a federal employee, you have the best advantage, because a lot of these things, other than whether I'm going to take Medicare A and B, your FEHB is going to help bridge the gap for you for that C and D. So you have to know when your clock starts also for your Medicare enrollment. Everybody, whether you work for the government, you're in private sector, if you've paid into Medicare, your initial open enrollment period, you have 7 months. You have 3 months before the month you turn 65. You have the month you turn 65, and then you have 3 months after you turn 65. So you have 7 months. Now, when those months start, that also depends on what your employment situation is. So making the right decision depends on whether you're working or not. So if you're still employed, you can wait. You don't have to immediately, even if you're 65 when you're working, if you can delay enrolling in Medicare Part B. If you're already retired, now your 7 months start when your birthday is approaching. How many people on here, if you're participating, your health insurance, you have an HSA, a health savings account. If you have a health savings account or you know someone who has a health savings account, it is very important that you understand how that works together, or how, make sure they know how it works together. Because if you're participating in an HSA and you enroll into Medicare Part A, they look back 6 months. So if you know you're going to be signing up for Medicare A, you have to stop contributing to your HSA account 6 months before you actually enroll, because you cannot keep contributing while you are enrolled in Medicare, okay, Part A or Part B. If you sign up for them at the same time, or you sign up for Medicare A first, they look back 6 months. You can't have any contributions 6 months prior to enrolling. So, how does Medicare and FEHB come together? Who's going to pay first? If you are still working, your FEHB plan is still going to pay first. So if you're still working, you only sign up for Medicare Part A. You can delay that Medicare Part B decision, because that one you have to pay a premium for. Medicare Part A, you do not pay anything for. So a lot of employees will enroll in Medicare Part A as soon as they turn 65, because it's free. It's not going to cost you anything. So while you're working, your FEHB plan is going to pay first. Then your Medicare Part A will pay second. Now, if you are retired, it's the opposite. When you enroll in Medicare A and B, your Medicare will pay first. Then your FEHB will pay. So it's the complete opposite. Now, a lot of my clients were concerned, well, I still like my Aetna. I still want to keep, my Blue Cross and Blue Shield or Kaiser. You can, and understanding the options that are under FEHB now, that you have enrolled in Medicare, because when you have both Medicare and your FEHB plan, because there are a lot of copays and different things that come along with Medicare as well. So when you have those two plans together, a lot of those copays and deductibles you no longer have to pay for, depending on which type of FEHB plan you enroll in. So let's take a look at 3 people who all are turning 65 in the same month. Let's just say they're all turning 65 in October. So now if the person is still working, their birthday comes up in October and they're 65, FEHB is going to still remain their primary coverage. They can enroll in Part A if they choose to, or they can choose to wait. When you are working and you get a special enrollment period once you retire, that 7-month period no longer applies to you if you are working when you turn age 65. Now, if you are retiring in October, you just retired. Guess what? And you turn 65 and you retired in the month that you turn 65. You also get a special enrollment period. Why? Because you were working and had a job that gave you coverage that matches the Medicare A and B coverage. Now, you will have 8 months from when you retire to determine, am I going to enroll in Medicare A and B? Do you have to enroll in Medicare A and B as a federal employee? It is strictly up to you. Nobody has to enroll in Medicare. It is not mandatory. You are not going to get in trouble. Medicare has what I like to call a carrot and a stick. The carrot is, hey, you're going to still have this great health coverage, although you're going to have deductibles and copays, but you're going to have health insurance. Now, if you decide, well, no, I don't, I'm not going to get it because I have my FEHB coverage. I love what I have. I don't need it. And then later down the line, you say, well, you know what? These copays are going up. I need more services. And I found out that Medicare would actually cover this. Now you want to come and enroll in Medicare Part B, and you can enroll. But Medicare says for every year that you could have enrolled and you didn't, there's a 10% penalty that is uncapped. So if 10 years down the line, you decide to now come back and enroll, you're 75, you're going to be paying double because you have 100% penalty. And then I'm not going to get into the part about IRMA. If you're making over a certain amount of money in retirement, how that affects your Medicare Part B premiums. And that's why having a plan in place is going to help you make all of these decisions. And we talk to each other, we talk to our coworkers, we talk to our friends and family, and they are quick because they want to help us. Oh, you need to do this. Nah, buddy, don't worry about that. This is how it works. This is what you have to do. And they mean well, but everybody's situation is different. So, how these choices will affect your retirement income. If you claim Social Security too soon, you're going to have a smaller benefit. But disclaiming early, if you have a plan, will that be okay? Also, if you delay Social Security, that is going to require you also having a plan to bridge the gap to create that income that you're going to need from 62 to your full Social Security retirement age. If you add Part B, that's going to create an expense for you. And that Part B premium, whether it's the regular premium or you have an additional IRMA charge on there because of your income, that money is also competing against all of your living expenses, all of the lifestyle things that you've set out to have. Then if choosing the correct FEHB plan, I'm sorry if this is popping up. Let me get this off here. Then also choosing the correct FEHB plan to go along with your Medicare option that you've chosen. Because with now in the FEHB plans, there are plans specifically that go along with you being enrolled in Medicare Part B. I have had clients who've signed up for Medicare and didn't let their health insurance carrier know. Some of these plans now give you a reimbursement to help pay for your Medicare Part B premiums. And then, of course, as I said, if you miss that enrollment period, you're going to have a penalty. So, these are the 5-step retirement checklists you should have. Number 1, check your Social Security record to make sure all of your earnings are on there. Put your retirement date on the calendar and then coordinate it. Look and see how my retirement date is going to correlate with some of these decisions I'm going to have. Then look at, hey, how is my health now? Try to estimate what some of your health care costs are going to be. And then, as I said, review your FEHB plan with Medicare to see, hey, should I enroll in the plans that are specifically for those of us who have retired and enrolled in Medicare Part A and B. And then you need to coordinate your decisions with your income plan. And that's why having a written retirement income plan to help you map out that is going to be important, because Confidence comes from planning. You all in the government, and I'm a former government employee, have some of the best benefits in the country. No doubt about it. And because we have that TSP, we know we're going to have two guaranteed sources of income. We still have to make sure we coordinate them. Because one thing I let people know is that having a large pool of money, that is not a plan. Because one what if in life can come up and wipe that out, such as long-term care. So I invite you, we have an acronym. We say, come and travel with us. Let us be your retirement travel guide. We build trust with you by building trust through our transparency and professional, personalized guidance that we can give you. We create a roadmap for you, a step-by-step plan, financial plan, roadmap to get you to the financial destination you want. And then you have the assurance providing confidence and peace of mind in uncertain times. It doesn't matter what's going on in the market. It doesn't matter what's going on in the economy because my plan already has it. And we bring value to you. We show you how to maximize the value of the benefits that you already have. And we give you the education like you're getting here, working with Sharon, working with myself, that's going to empower you through the knowledge of your federal benefits and financial strategies. And lastly, as I said, we put a bow on it and help you protect all of your and pass your assets on through our legacy planning. So what are your next steps? You can coordinate. Let's get together and schedule that 15-minute consultation. We can go over all of the questions that you have about your situation. Scan the code here and let's have a conversation. That's it. Thank you. I'm going to stop. I'll leave this up for a few minutes, Sharon.
Okay, and the information, there's a lot of links in the chat, and you'll be able to click on those and find out more information, schedule the complimentary consultation with Darlene and myself, and the QR codes that she showed, as well as the one that I'll have on my screen. So we want to make sure that we can get some time in for questions. And so we'll be just wrapping up. Darlene gave you some steps that you need to do. And in addition to those steps, I'm going to tell you that you need to make sure that you're reviewing your health insurance plan, reviewing your life insurance coverage, making sure that your beneficiary forms are all up to date, your TSP, unpaid compensation if you're still a federal employee, your life insurance and your retirement beneficiary forms. Make sure they're up to date and has all the information on each one of them based on what you want to have dispersed and the way you want to have dispersed. And of course, keep learning more about Medicare and Social Security. Reach out to Darlene, and she's an expert on this, and she can tell you, because all I'm going to do is refer you to Darlene. So you might as well just go ahead and make the appointment with her so she can explain everything to you. And as Darlene said, make sure you have your dates and things written down, your questions, and put the information on your calendar so you can be able to contact not just myself and Darlene, but your HR office, OPM, Social Security directly if you have any additional questions. So I also want to tell you about next month's webinar. And this is a retirement literacy series. So every month we're going to be talking about federal retirement. And next month we're having part 2 of this session. And we're going to be covering CSRS offset first supplement. We're going to be talking about a high 3 salary, credible service, retirement applications, and possible OPM processing delays and errors that come up. So you want to make sure that you're registered, scan the QR code that's on the screen, or click on the link that is in the chat, and you'll be able to register right now. Get your Zoom link come to you right away, and then just put on your calendar so you can have it and remember that it's coming up. In addition, I'm launching a course, and it's going to be coming in October. And this is going to be a 6-session course that will take us from probably around the beginning or mid-October all the way right before Thanksgiving. And you'll be able to get even more in-depth clarification on your federal benefits and retirement. And in addition to going over those things, we'll be talking about creating your own retirement readiness plan. We'll be talking about tools and things that you need. And we will also have Ms. Darlene Jenkins come in and do some financial planning with you. So I'm excited that she has agreed to collaborate on this and be part of this great course. So you want to make sure that you are looking into the chat and dropping, making sure you look into the chat or scan the QR code, click that link in the chat that says the Confident Fed Benefits Blueprint. That's the interest form. Now, why am I doing this interest form? Because you're going to be part of the first cohort. So we want to make sure that we have the right people in the room. So you want to make sure that you are completing the form so we can get back with you and share with you all the important information that is needed for this course. So make sure you are dropping that into the chat, going into the chat, clicking the link or scanning the QR code, and both of them will take you to the interest form as well as all the other information that's on the screen. And I forgot to mention that in addition to all the great information you're going to find out during the actual course, I'm offering 2 individual coaching sessions to every participant. That means that you'll be able to meet with me directly twice for us to go over what's going on with you, with your retirement, the questions that you might have, and how we can get to that retirement lifestyle that you're looking forward to. So again, making sure you scan the QR code or go into the chat and click on the link so you'll be able to get on that priority list and be part of the first cohort for this session. So there are a lot of things that you need to do. Register for the course, register for the upcoming webinar next month so you can be a part of part 2. Make sure that you are clicking the link and scheduling that complimentary 15-minute session with Darlene and with myself. And stay on because we are going to answer your questions in just a minute. So I want to thank you for being part of today's session. And I'm going to stop sharing and recording.